I am Pete Makowinski, Director of Design Consulting with GCOM Manufacturing, and I'm here with
Tony Manzano, Chief Scientist Officer and also co-founder of AZON.
And we lead the Biopharmaceutical Manufacturing Interest Group within the PDA, and we're happy to be here today. And I wanted to give you a little bit of history of our interest group. We started off back in about 2017. Our IG actually formed from the old Biotechnology Interest Group. And one of the great things about us being here at the PDA FDA conference this week is we're actually going through an official rebranding of our IG, and we will now become the Advanced Manufacturing and Process Analytical Digitalization IG. So it is a mouthful, but the purpose of the rebranding effort is really to help get more focus within our interest group and targeted audience, so the content that we're providing to our members is more relevant.
Actually, the pharmaceutical industry is experimenting this evolution in terms of digitalization, and biomanufacturing is part of that, of this evolution. So it's a requirement.
Yeah, excellent. And also within the advisory board, which our interest group is under, we actually just got approved for a new task force, and Tony actually will be co-leading that task force on digitalization. Do you want to maybe talk a little bit about
Sure. Actually, the other colleague is Mirko Gabriele, coming from the PDA Italy, in the chapter of Italy. Well, we realized that in biomanufacturing, we need to have very clear which is the steps we have to follow in terms of adopt the new digitalization. Biomanufacturing is the best place to do that, and the idea is to create a task force where we can demonstrate the real value in a pragmatic way, with the foot on the ground, with a real experiment out how we can move forward in this digitalization process since the beginning. So we are in a paper base how we want to go to the final and excellent digitalization. This is the essence of the task force.
Yeah, you know, it's a great point, because even within the PDA and even industry, I think people have a tough time wrapping their hands around digitalization and what it means for them. And really the purpose of the task force, as you mentioned, is to drive some focus within the PDA. And one of the most important things about a task force is getting a solid foundation of members that have the right background and expertise. And we did want to, use this opportunity to, call for action in terms of anyone that has interest in supporting this task force to, put your names forward. There is the IG session today that you're happy to reach out to either of us if you have that interest, and then we'll also be utilizing PDA Connect as well as email blasts to look for those volunteers that have an interest in this area.
We promise that we will enjoy a lot in this adventure, and we have a lot of challenges that probably you will learn a lot from them.
Agreed. And then we will actually have an IG session today. It's a joint IG with the Facilities and Engineering Group. That's being led by Shelley Pressler. And we'll also have contributors from the FDA joining us for that IG session to help moderate it. And that'll be Christina Capacci-Daniel as well as Rebecca Dowd. So that's going to be a very interesting IG session. We have a couple of talking points or subject matter around digitalization. I know that one of the talking points today that we're going to have is around applied digitalization.
Yes.
I don't know if you want to talk a little about what your thoughts are there.
Yes, of course. Actually, digitalization is in the mouth of everyone around the pharmaceutical world. The idea is that people is trying to put their experience and which kind of interest they have in this journey. Mm-hmm. So digitalization has different levels. So you can adapt. You can be adaptive to the digitalization. You can accept the digitalization as it is, or you can wait until the digitalization goes out and you see how it passes around you. Well, people want to go in the digitalization level, but usually they don't know how to start. Mm-hmm. How we start? We need to think big. We need to start small, and we need to scale fast. This is the three main topics in order to success.
No, agreed. And I know some of the other point of discussion will be around regulations around AI and how that can be approached. Continuous manufacturing will be another topic of discussion, multimodal facilities, and rounding it out, we'll be looking at deviations and how to handle deviations within manufacturing and some of the best practices there. So we're definitely looking forward to that IG session later today, and all the participants and attendees that we're looking to join us. So I think as far as this discussion goes, it's going to be very fruitful for all the people that do attend.
Of course. Good. So I think that from that, we only can say that we are really happy to see how the PDA is supporting also these initiatives. Actually, the pharmaceutical industry is requesting this kind of help because we have all the tools in place, but we don't know how to start. So with this kind of initiatives, PDA is demonstrating that there is a way, and the collaborative way is the right path to follow.
Yeah, no, and PDA's done a great job of helping to provide the resources, and we appreciate PDA of putting this conference together to provide the foundation for all the IGs and discussion points. So we do want to acknowledge that, and we look forward to seeing everyone later today.
You will be very welcome.